We start, though, with the COVID-19 situation in South Korea. The daily caseload continues to hover around the 100,000 range. As a result, the number of people receiving treatment at home is climbing at a rapid pace.
For more, our reporter Shin Ye-eun is here in the studio with us. Good morning, Yeun.
Good morning.
So let's start with the tally for today.
Mok-yeon, we're expecting to see the daily figure reach the high 90,000s because as of 9 p.m. Sunday, we saw 93,260 new infections. Though this was a drop by some 7,000 from a day ago, it was still roughly double the amount reported the same time last week. And following Sunday's edition, South Korea has now recorded more than 2 million infections nationwide. The country added more than 1 million infections in the past 2 weeks. On February 6th, we saw the total COVID-19 tally surpass 1 million for the first time.
Now, given the surge in the number of Omicron patients, the number of people treating themselves at home for the symptoms of this variant is also on the rapid rise. Just how many people are at home, isolated, treating themselves for Omicron right now?
Well, as you mentioned, we're seeing the number of people being treated at home double, just like we're seeing new Omicron infections double each week. As of Sunday, there was a total of 450,493 people receiving at-home treatment, which was actually twice the amount reported a week ago. Compared to 2 weeks ago, this figure has gone up by roughly fourfold. Because figures are doubling each week, many have raised concerns that medical infrastructure is unable to keep up. Authorities tried to address this medical crunch by expanding the number of hospitals and clinics that provide phone counseling or provide remote prescriptions. As of February 10th, there were only 1,856 clinics. Authorities expanded this number to more than 6,050 in a week. But many have raised concerns that there still aren't enough medical staff on standby to help those who need to be treated at home, especially those who are in self-isolation without a caregiver in the same house. Now, if you recall, in early February, health officials divided people infected with COVID-19 into two categories, the intensive management group and the regular management group. Those in the intensive management group are subject to constant monitoring and more intensive care because they're considered at high risk. They receive 2 daily health checkups from medical staff who are always on standby. They also receive treatment kits, which include fever medication, thermometers, and self-test equipment. They may also be prescribed with Paxlovid, the antiviral COVID-19 pills. To fall under this category, you either have to be immunocompromised, 50 and above with underlying conditions, or aged 60 and above. Most people are asymptomatic or have mild symptoms and therefore fall under the regular management group. And this group isn't provided with treatment kits, nor are they actively monitored like those in the intensive management group. It's only if their symptoms worsen that this group can contact their local hospital or clinic to access remote healthcare services. Now, once they receive permission, they can visit an outpatient treatment center, but contacting local hospitals has been quite the headache for this group because many have said the lines were always busy. So there's constant demand for more medical staff standing by for people at home that need care, as we're expecting to see the number of people with COVID-19 at home reach 1 million by early next month.
So given the situation, how are authorities responding to this?
Well, apart from asking more hospitals and clinics to provide remote health services to people at home, authorities are trying to supply more self-test kits and give out antiviral pills to more of the population. The Ministry of Food and Drug Safety said they would provide 21 million COVID-19 self-test kits to some 75,000 stores nationwide this week. This was up by 2 million from what was distributed last week. The total number of kits set to be distributed in the 3rd and 4th week of February is 10 million more than what authorities had originally planned. Also from this Monday, authorities will also expand the age group that can take Paxlovid to those aged 40 and up who have underlying conditions. Moving on to the vaccination front, authorities have added Novavax for use in the country. People aged 18 and up who haven't been vaccinated can make their Novavax shot reservations on Monday. And Novavax is the first protein subunit vaccine to be manufactured in the country. country. This means that it uses a more traditional method, like those used to develop vaccines for hepatitis B and cervical cancer. So watchers say there are fewer concerns about side effects, which is particularly good news for those who haven't gotten their shots or had to stop in between due to side effects. And Novavax vaccines can be used as boosters and mix and match shots. Inoculations will start from March 7th, and once people reserve the date to get their first shot, the date for when they can get their second jab will automatically be reserved for 3 weeks later.
All right, Ye-eun, thank you so much for your report. We'll talk to you again later in the week.
Thank you.